Now this man go one event. MC talks, say, made them appreciate and made them clap for him. Some people out of bad belly, they no clap for him. 2 weeks after the event, the people will refuse to clap for him. One day for in hospital. All of them, their hand they up. Waiting happen. Wicklow, don't catch me. Let's appreciate Dr. Chris Otabor. Yes, over to you, sir.
Thank you, Ordinary President. Good morning, Ordinary President. Good morning, Brekete Family. I don't know if you can. Am I on?
Yes, sir.
Okay.
We don't improve now.
Oh,
It be
great.
like we'll be like your hospital where they improve day by day.
Ordinary President.
Now this man hospital I go, that thing where then they put person like container.
MR.
Now be RMI.
MRS.
MRI. That where you go lie down, complete body like this. You go, then they go just when you go to hear. They say other hospitals own they make noise. I never enter them before. Enter that. They do the by the time they finish, ask me waiting. Sleep off. Sleep carry me go. They can't they wake me up. That same the following week, I see one elderly Fulani woman. They won't put on say around the bayan chegaba.
Ordinary President, I want to thank you again for the opportunity to be here to share my knowledge with the world. And I thank you for what you are doing. You are a blessing to mankind. I know you've been hearing this all the time, but we'll have to keep saying it because that is what you are. You are a light that is shining in a dark world. And just imagine what happened here today. This is just an example, and this is what you do every day. Not just in terms of your physical, reaching out to people financially with food stuff, but every morning here, you dish out from within you knowledge that is invaluable. We cannot pay for such knowledge. And I know that you read a lot. So you do the work, pull out the knowledge from the books, and then you feed the people with the knowledge. God will continue to bless you. Amen. Thank you. So today, I'm going to be talking about a topic that affects everybody. Though it's a woman disease, but it affects their husbands, it affects their brothers, their parents. So at the end of the day, it's everybody is affected. And the topic is fibroid. Yeah. Fibroid, almost everybody know one or two things about fibroid. But there's a lot that the general public need to know so that we can make informed decisions and do the right things so that we will not be affected negatively with this disease. What is fibroid? Fibroid is a common non-cancerous growth. It's not a cancer. It's a growth, but not a cancer. There are two types of growth: cancer and the one we call benign. So the good news is that fibroid is not a cancer. If not, it would have been a disaster because of the number of people that gets it or that will have it in their lifetime. It affects the womb, the uterus. The growth is made up of fibromuscular tissues. It's just like muscle, but it's like fibrous tissue. So who are those? How many people are affected? About 30% of women have fibroid at any given time. Women in the reproductive age group. That's between the ages of 20 and 50. But particularly from 30 to 50 is more common in those age groups. What that means is that for women in the reproductive age, if there are 10 women in this room, at least 3 of them have fibroid, whether you know it or not, because majority of people who have fibroids don't know that they have it. Yes, because it is largely asymptomatic. Fibroid does not always manifest. It is the one that is causing problems that people get to know easily. But many other people get to know that they have fibroid when they go for checkup for other things. Maybe they just want to check whether they are pregnant, and then they do a scan and they discover that there's fibroid in the womb. Or if any other thing causes them to go for an ultrasound scan, they will discover. But apart from the 30% that will have fibroid at any time, 80% of women will have it in their lifetime. That means 8 out of every 10 women will have fibroid in one way or the other throughout their lifetime. It's almost everybody now. I mean, 8 out of 10. That's to tell you how common it is. It's a very common condition. So the peak age incidence is between 30 and 50 years. About 50% of the surgery that is done to remove the womb, 50%, half of it is because of fibroid. So very often in busy hospitals, we have to advise women that their wombs have to be taken out. And in 50% of the time, the reason for that is because of fibroid. There are other reasons like cancer of the endometrium and maybe bleeding. But 50% of the time, the indication for hysterectomy, which is removal of womb, is because of fibroid. And about 30% of all gynecological admissions is women issues. 30% is admission in the hospital is because of it. What's the cause of fibroid? The cause is unknown. Yes, up till now, we don't know what causes fibroid. But it is associated with certain developmental stage in the life of a woman when the women hormones start coming. Estrogen, that hormone that makes a woman, that makes her look beautiful and look attractive and her skin is shining and that gives her all the curves. That hormone, when it starts surging, that's also the time we notice that fibroid also starts coming up. And the hormone is actually what feeds the fibroid. And so we also discovered that as women get to menopause, the fibroids begin to shrink. And what happens in menopause? The hormone has ceased. The estrogen is no longer there. So once the hormone is not there to feed the fibroid shrinks. And that's why for elderly women, maybe in their 50s, when we discover that they have fibroid, we don't want to do anything about it because ultimately it will shrink by itself. Because
let's appreciate doctor. But some people will go on collect money from these women. They go tell them, say they require surgery. But Dr. Otabor don't tell us, say, once you then the elderly, you don't enter menopause, even if you get fibroid, don't overbother about it because naturally it go shrink and it go away.
So if a woman's close relative, maybe the mother or the sister, have fibroid, then she has a very high chance that she will also have fibroid.
So a young girl of 22, 23 if it get fibroid.
It's possible, but not common. It comes up as people approach 30 and up to 50.
But a man know they suffer fibroid.
Yes, because man don't have womb.
Una they laugh me now because I ask question. Okay, I no go ordinary.
So, and fibroid is commoner in blacks than in the whites.
Can a woman suffer prostate cancer, prostate enlargement?
This is the same answer. No, because they don't have prostate.
So when I say this fibroid now for women.
Yes.
Prostate now for men. una don't learn now.
Yes.
Even if exam come tomorrow, now this example now una will take remember to pass exam. And I know now no go clap for me now. I don't bet. Continue, sir. Sorry for interrupting you.
Thank you, Ordinary President. Okay, so how do we make a diagnosis of fibroid? Let's talk about the symptom first. Like I said before, majority of fibroids would be without symptom. Yes, symptomless. For many people, it's after they get married and they've been trying to conceive 1, 2, 3 years, they are not able to conceive and the man is okay. They now come to the hospital to say, I've not been able to get pregnant. What's the problem? And when we do a scan and we discover that there's a fibroid that is blocking the pregnancy. So that's when some people ever know that they had fibroid, because it has not been symptomatic all along. But where fibroid have symptom, it depends on the location of the fibroid in the womb. That's what also manifests with the different symptoms. But the common symptoms of fibroid is abnormal bleeding. For women that are menstruating, it could be irregular bleeding. When you are not expecting your period, you are seeing it. It can come twice in a month. It can be very heavy. In fact, this very heavy bleeding is a major cause of death for women who have fibroid. Yeah, it's also a major cause of emergency admissions, because the womb is richly supplied with blood, and that the vessel that takes blood to the womb is directly from the aorta, which is from the heart. So if there's a lot of bleeding going on from the womb, a woman can lose her life from that bleeding. And fibroid is one thing that can cause torrential bleeding for women.
Sir.
So heavy bleeding, prolonged bleeding, they are symptoms of fibroid. Some women who have low abdominal pain just around the waist and low back pain, and they also experience abdominal mass. A swelling.
It would be like say then they pregnant.
Yes, when it's big enough. When it's now big, fibroid can be as little as a grain of rice or beans. It can also be as big as a watermelon. Yes, a big size watermelon. So there's no limit to this extent of growth. And the one that you see that is so small today, after 3 years, it can become so big. That's why some people, when they do fibroid operation, and then after some years, they are telling them that they have fibroid again, and they are like,
grow?
Yes, yes. No, it's not that one that was removed.
Another one don't come.
Yes. Another one that was tiny before will now grow. And sometimes they say, oh, the doctor didn't do it well. No, it's not the doctor. It's just that there are new growth that are coming up as they have become big. Then fibroid can cause pain during sexual intercourse. It's one of the commonest causes of pain. And then it can cause frequent urination. And patients with fibroid, the only thing that can bring the person to the hospital is that he's very weak. And that weakness is as a result of loss of blood. Yes, so we look out for that. Then, like I said before, one of the major reasons why we discover fibroid is when women have not been able to conceive for a long time. So for infertility purpose, they come to the hospital and you do a scan and you discover that they have fibroids. And once you take out the fibroid, in 3 months, they are pregnant. So that's let me just talk about handling infertility when it comes to issues like this. Sometimes you see a woman who has been married for upwards of 5 years, 7 years, and she's not able to get pregnant, and she's not doing anything about it. That's not being smart, because some of the reason for the infertility might just be something so small that you need to take away. You can't be trusting God for something that God has given you knowledge to handle. All you need is just go, you do a simple scan, they tell you, oh, this. Some women, their tubes are blocked. That means no pregnancy, no matter what. And so you start looking for alternatives. The reason I'm saying this is because I've seen people who have been without child for 15 years. It's now that they are waking up to ask why. Why are you waiting for 15 years? Why didn't you ask after the second year of not being able to get pregnant? So, and it may just be that small fibroid that is staying exactly where the baby is supposed to be staying. So it's not like there's no pregnancy, but the baby does not have a space to stay. So it goes. And then it comes in, month out, week, year in, year out. It's useless. So just, make sure that you resolve whatever issues that can be resolved so that you can make progress with your life. So examination, when the patient comes to the hospital, whatever is the reason that is bringing the patient to the hospital, the doctor will have to examine. It starts with general examination. And sometimes when you open the eyes, you just discover that they are almost like paper white. Yes. And that shows chronic loss of blood or severe loss of blood. Because this one way, when doctor says, let me see your eye, he's checking for your blood level. Because
doctor, check my own.
Honorary President, he needs to donate blood. Your blood's too plenty. Okay, on the lighter note, but you are excellent, Honorary President.
Thank you, sir.
So when we check the level of, depending on the symptoms, sometimes we have to even resuscitate the patient first before we even talk about the fibroid. Because he has lost so much, his pain, loss of blood, weakness, and everything. So we need to bring the woman to be strong and okay before we even address the fibroid. And then that chronic loss of blood can also affect the heart. The heart can become stressed. Then when we examine the abdomen, we may or may not find a mass that's a swelling. If we find a swelling, that means that it's a sizable...
Which side, the abdomen for person chest?
Chest is different from abdomen.
Okay.
Yes.
Where abdomen is?
Abdomen is that part of the body below the rib cage.
When be belly?
Yes.
Oh, okay. I know as I hear abdomen, I think say it did for chest. You know abdomen before? When I know that.
Okay, so after the examination, we now send the patient for investigation. The commonest investigation that we use to diagnose fibroid is ultrasound scan. Ultrasound will show the presence of the mass. It will also show the location where it is. If I'm looking at the ultrasound alone, you can tell a lot about that fibroid. Yes. So then we also do CT scan. We can also do MRI scan. And we also want to check the patency of the tube. We do HSG, where we put dye to be sure that the tubes are still patent. And of course, the blood test to be sure that about the blood level and all that. So after the diagnosis has been made, the next thing is to counsel the patient for treatment. And the treatment will depend on many factors. It will depend on what symptom the patient has. It will depend on the age of the patient. It will depend on the ambition of the patient vis-a-vis her tendency to have more children. If we find a woman of maybe in her late 30s or early 40s who have completed her family and she's bleeding seriously from fibroid and she's constantly complaining of pain and all that, the best advice for that woman, especially when the fibroid is big and it has twisted the womb, the best advice for that woman is to take out her womb. For some people, it looks like it's something really big and an abomination. But the womb was given to us by God, for to women by God, to bear children. That's the only function that the womb is there for. When that function has been concluded, then why risking your life? Because if you don't take care of that fibroid, the fibroid can take you out. And also, if you remove your womb, you have also removed the possibility of cancer of the womb in the future. So there are many advantages of removing the womb when it is necessary and is indicated. So for patients that have pain, we give painkillers. For patients that has lost so much blood and they need resuscitation, we give them blood. And then we can also give some other medications like oral contraceptive pills. And there's what we call gonadotropin releasing hormone. They just help to shrink this fibroid a little bit before the surgery. So the mainstay of treatment for just the way majority of people who have fibroid don't know about fibroid, don't know that they have it. Same way, majority of the fibroids would not need any treatment. Yes.
So you go just day there and the person go survive, do normal things.
Yes. If the fibroid is not about Pamela, can we have those pictures?
Okay, control room.
If the fibroid is not located, okay, so those things are fibroid. Yes, the one that the arrow is pointing to, those ones. So the one that is on top is inside the muscle. Then the one that is on the right side of the screen, that's the one that is called the submucous. Just submucosal. The one at the middle, the ones at the middle, those are the ones that will really prevent pregnancies. Yes. The one on top may not really do too much to prevent pregnancies. Some fibroid can coexist with pregnancy. Some will allow pregnancy, but they will trouble the pregnancy. Yes. Some fibroid they don't have any problem. You can get pregnant. But by the time you get to 6 months in pregnancy, the fibroid can become a problem, and so on and so forth. So depending on the location of the fibroid, the surgeon will take a decision on what to do.
See another one, sir.
Yes. So for fibroid that is causing infertility, the best thing is to take out the fibroid through a surgery that is called myomectomy. And the one that is causing severe bleeding and pain, we can also remove the fibroid, and that would end the whole trouble. The fibroid that is very big, it's also good to take it out because ultimately it's going to cause trouble, even if it's not causing much trouble now. The surgery of myomectomy, though it's supposed to be a very safe surgery, that's the fibroid surgery, but unfortunately, a lot of women have lost their lives because in the process of that. So women are asking, what do we do if we leave this fibroid? You tell me that it's risk to my life, but if I go for surgery, there's also a measure of risk. So that's why you have to really be sure where you want to do your fibroid operation. Yes, and dedication. For when you have a hospital where the team is dedicated and the surgeon is careful and is down to earth surgeon, he will be able to. No surgeon does fibroid operation and just go home and switch off his phone and sleep. You have to be checking every now and then. You know why? During surgery, the anesthetist, who is like the pilot, would reduce the blood pressure of the patient to reduce the bleeding. And so there are some blood vessels that are bleeding that we tie up during surgery. But after surgery, when the blood pressure has come up, the patient is in pains and blood pressure has come to normal. The high blood pressure can cause those sutures to pull out. And patient can bleed after surgery. And if the bleeding is on and nobody is observing it, she can lose 5 pints of blood within hours without anybody knowing. So by the next day you are coming to the hospital, the patient is paper white, and she's using up the blood clots in the body. You start running. Before you know, you discover that the woman is bleeding from all over the body because blood clot is no longer available to clot the blood. So that's what we call DIC. When it gets to that point, the woman, 9 out of 10 of those people will go. They are not going to make it.
Wow.
So if you do a surgery, and the young surgeons,
you have to be sure of where you're going for the surgery.
Yes. This is what they teach us. When you do a surgery, especially a surgery like fibroid surgery, you must come back and check. And the nurses must be told to monitor the vital signs. If the pulse rate is rising, you know that something is happening. They call the surgeon, please come and check. The pulse rate that was 80 when the patient came out of theater is now 90. That is enough warning sign to start rushing back to the hospital if the surgeon has gone home. And then you check, do another ultrasound. If you see bleeding, take the patient back to the theater. There's no doubt that incidences will happen, but it's how you handle it that will make the patient survive. So you understand why the surgery of fibroid is a bit tricky, depending on the availability of resources. For instance, if you have a hospital where the surgeon just visited to do the surgery and he has gone back to his place, he may not be able to come back, unlike the surgeon that is on ground. Anytime they can call him, your patient is this, and he goes back there. So the dedication of the surgeon has a lot to do with the survival of that woman. Should there be an incident? And you know the reason why it becomes a big news. And we're all aware of such news. There's hardly anybody here who have not heard that a woman did fibroid surgery and didn't make it. Yes. The reason why it is news is because the woman is not supposed to die. No woman should die from a fibroid operation if all the necessary care is given.
No matter how big the size is.
No matter how. The worst that can happen when you are doing the surgery, if it's a delicate fibroid operation, you can take a consent from the woman and say, look, if push comes to shove, we'll take your womb out. Yes, because we can get to that point where you are doing surgery, the bleeding is uncontrollable because you have removed surgery, so the blood vessels are opened up. You have removed some of the fibroid, the blood vessels have opened up, and everywhere is bleeding.
In order to
save her life, you can take out the womb. Yes. And good enough, these days, you don't even need your womb to give birth. We have a lot of IVF procedures. We take your husband's sperm, take your egg, fertilize it, somebody else carries the baby, and after 9 months, you carry your baby, it's your baby. So why would you risk your life because I must keep my womb? It doesn't make sense. Yes. There was a woman that we delivered. I remember 2014 in our hospital. She just delivered, and incidentally, they are my family friend. So the gynecologist called me in. He said, Dr. Otabor, MD, we need to take a decision now. This woman is bleeding and we'll lose her in 20 minutes if we don't take her womb out. She's got this. That baby was the second baby. I called her husband. I said, you have to take a decision now. We're taking your wife's womb out. He said, if that is what is necessary. And we took out the womb, and the woman is fine. Today, I see the boy is about 10 years, 11 years now. And the other daughter is around 13 or 14. I see them, happy family. But if they were being stubborn and said, no, my womb, she would have gone under the ground by now.
Thank you.
So it's good to take informed decision at the right time. So that's about a fibroid operation. Then, like I said before, if the womb is twisted, the family is complete, you take out the entire womb for everybody to have peace. There's also a procedure that is done, it's mainly done for smaller fibroids. It's called uterine artery embolization. You target the artery that is feeding the fibroid, and you just inject it with some things. The artery closes, and that the area where the artery is supplying will just, wither away. And that is done, but it's not for everybody. Not everybody can benefit from it. Most of our patients come late because of that. They are not even candidates for that kind of intervention.
When we dey small, we go see women we carry pregnancy for more than 3 years, 4 years. They say na spiritual pregnancy.
Exactly.
I don't know whether you don't hear them before.
Very well, Ordinary President. In fact, when I was preparing for this topic, that thought came to my mind, and I still picture that one of our family friends then, that we used to gossip about her. That woman has been pregnant for many years. As we grew up to find the woman thought to be pregnant.
She was pregnant.
Till I lost contact with her, she was still pregnant. Ordinary President is fibroid. It's not pregnancy. And some people still deceive themselves till today. Maybe they have even reached menopause. They are not, because their tummy is big, they say it's pregnancy, that they will soon give birth. You can't give birth because there's no baby there. It is fibroid. So it's not every swollen stomach that's
you
a
tell
baby.
them say na fibroid, they go say from time to time the thing they move.
Exactly.
Yes.
Okay, so complications. I will soon round off.
Okay.
Complications. So menorrhagia has excessive bleeding from during the menstrual period. Dyspareunia, that's painful sexual intercourse. Miscarriage. Intrauterine growth retardation, that's the baby will be small for age because the fibroid has competed with the baby for space. Preterm labor, where very often a woman that has fibroid before she got pregnant, depending on the position and the size of the fibroid, it can disturb the pregnancy when the pregnancy is maturing. So you discover that the labor starts before the time, and then you are going to have a premature baby. Of course, infertility, I've talked about it. There can be serious pain from degeneration of the fibroid. Then there can be placenta previa and abruption. The placenta can be lying in an abnormal position, now preceding the baby, such that if the woman pushes during labor, she can bleed to death.
But now the placenta go they move.
Because instead of the placenta to be behind the baby, so that the baby comes out, then the placenta follows. Then the fibroid has distorted the womb. The placenta is now before the baby. So in the trying to give birth, the head of the baby is pressing on the placenta. It's causing a lot of bleeding. And that one is cesarean section. Nobody can ever tell you to try to give birth by yourself. If they say placenta previa, just know that it's cesarean section. If that woman ever gives birth or enters labor, she's likely not to survive. So it's very important, and fibroid is one of those things that can cause that. Then fibroid can also cause postpartum hemorrhage. That's severe bleeding after giving birth, because after the women give birth, their uterus contracts. It's like a sponge. It comes together, but with the presence of that fibroid, that contraction is lost, and it's that contraction that squeezes the blood vessel to stop bleeding. Yes, so if the blood vessel just keeps open, then bleeding will just continue.
With a no closer.
Yes, exactly.
Continue.
Exactly. And that can be very terrible. It can lead to death. So these are some of the points about fibroid. I said we don't choose fibroid. In conclusion, we don't choose fibroid, but fibroid chooses us. Some of us. But with accurate knowledge and informed decision, we can defeat the plague of fibroid. Thank you very much.
So any man will get fibroid now. Oh, sorry. They say man, no, they get fibroid. Yes, sir.
That's doctor. That's quite a beautiful illustration of fibroid.
Thank you.
For example, if a woman has a fibroid and is pregnant, for example, so what is the best way for her to deliver? Yes.
Okay. So thank you for the question, sir. He has asked a question. Say if a woman has fibroid and she's pregnant, what's the best way? So there's no one particular way. First of all, it depends on the location of the fibroid. Many times, the fibroid does not disturb the pregnancy. If the woman will be able to give birth normally. But in situations where the fibroid would prevent normal delivery, then it will have to now become a cesarean section delivery. And during that cesarean section, what you are after is the baby. You go and take out the baby and leave the fibroid alone. Because if you go after the fibroid, the woman can bleed to death. Yes. So you just take the baby out, close the womb. Later on, when the womb has settled, then you can go and remove the fibroid.
One thing at a time.
Yes. Though there are a few instances where the fibroid is directly on the way. In that way, you remove the one that is on the way so that you can get your baby out. But the standard practice is to leave the fibroid alone and take out your baby, and then you can address the fibroid later.
It's just like the example of they say two things, you know, fit to do two things at the same time. Say you they run, you they scratch your bum. Say it's either you stop, scratch bum finish, you run, or you run finish, then you scratch bum. No, you know, you combine them. If you come out here, try and make it see. It's either you know go scratch and well, or you're gonna go wrong well.
Well, yes.
Yes,
Okay.
Thank you, doctor.
Okay.
That's why it's just to take a decision to go cesarean.
I said it depends on
It be like saying, you know,
depends on the location and the size of the fibroid.
fibroid.
If the fibroid will not disturb normal delivery, the woman delivers, you do it as though there was no fibroid. But if the fibroid is big and is going to disturb the normal delivery, then you have to choose cesarean section. And when you choose the cesarean section, you take care of the baby. Later on, you can go and take care of the fibroid. Yes.
It's just like when some people go get wound outside, can't get fracture. Abi? Now we be bone doctors. They go first take care of one first before the other one.
I hope the question is all right.
Okay.
Yes,
Thank you,
Elder.
doctor. I want to ask a lady with a ostomate. Is it possible to have baby?
Which one be customer?
Ostomate. Is it
Custom made.
ostomate?
Custom made.
Ostomate. That, you know, he has a particular thing, surgery on her stomach, that now pass feces through her stomach.
Osteotomy.
Okay.
Colostomy.
Okay.
Colostomy.
Now, doctor, terminal language now. So, maybe that don't blame me. You said iron.
Hey. Now my father on the laugh.
No, sir. We just dey laugh, sir.
If say na iron they talk now, I go handle am well. Or cement. My ordinary
Hold
president.
on, custom made.
Custom made.
You understand custom made now?
Yes.
Oh yeah, explain to us.
Okay.
Make una clap for my father.
Yes, she can have pregnancy. She can get pregnant and give birth.
Wow.
Yes. That's the digestive system. The reproductive system is different.
Wow.
You can.
Now channel by channel.
For instance, let's say a woman is pregnant and maybe there was a gunshot wound to her intestine that missed the baby, and the surgeon is able to bring out the intestine for her to be able to pass to while waiting for that place to heal up. You are not going to touch the pregnancy. She can still deliver. Yes.
Thank you.
And if it is a permanent colostomy, where maybe it's due
permanent.
Yes, if it's a permanent colostomy due to tumor or something,
Yes, sir.
and then she can still give birth.
Wow.
She can still get pregnant and give birth.
Yes, Chef Fatima,
Thank you so much, sir. Doctor, all these tests, can a woman walk into a facility to check all these fibroid and other things? Just like that, you just walk in
on your own.
on your own, because like you say, if we don't go for it, we don't even know. That means, can we walk in and
Yes.
check for all
The
Yes.
this?
simple answer is
Yes,
general medical checkup from
Exactly.
time to time.
I've discussed that here before. Annual medical check. When even companies sponsor their staff
Okay.
to come to the hospital to run annual checks, and one of the checks to run is abdominal ultrasound scan.
Okay.
That can show a lot. It can show whether there's a fibroid or not. So it's also not a good idea that it is only when trouble has come that you know that you have fibroid.
Thank you.
It's good to know what is wrong with you generally
Thank
before
you.
that time.
Thank you very
Yes.
much.
An
Make we
annual
appreciate.
check will help.
My ordinary president, now to guide the women. Some women, instead of going to the hospital to know what thing they do,
They will go prayer house.
they'll go prayer houses.
Oh, native doctor.
They'll go to native doctors.
They say-
They'll start drinking
They
herbs.
say
To
this one
melt-
will
to-
shrink
to
am.
melt-
Yes, that
it
it
will
will
melt am.
it will melt it.
If you not melt the fibroid, it will melt your life away.
Yes, sir. And it's killing many women.
Mm.
It's killing many women.
Thank you for that point, sir. I just
sir.
wanted to say something about that. You know, we are a people of faith. In Nigerians, we are even Islamic faith, Christian faith, and we believe in that. And I also believe. But the first question you ask yourself, how did you know that you have fibroid? The imam of the pastor did not tell you. It was a doctor that did a test that made you to know that you have fibroid. If you go meet them and they have prayed for you, it's okay. Maybe once in a while there can be a miracle. I believe in miracles. But you have to confirm that by going back to the doctor to say, this fibroid, is it still there? If it is still there, please do the right thing. Don't play the ostrich. And they just tell you you have been healed and you didn't go back to check that you have been healed. That's foolishness.
They say if you go to confirm your faith, you are not strong in faith. You are not strong in faith.
No, even Jesus Christ told people that he prayed for. He said, go and confirm your healing. Yes, it's in the Bible.
Thank God. I go hold this one. I go hold this one. My brothers, my sisters, if I look at and assist time, don't they give us signal to do things. Signal make we allow Dr. Chris Otabor, make you go back to the hospital, make we go continue to the save lives. Make we appreciate him. Dr. Chris Otabor, thank you very much for coming. Thank you. When I don't go clap for him now, see they go. When I don't go clap for them now, they look them. Anyone welcome. Anybody will not clap, welcome. See this one where we are red shirt. You know, when I don't go clap now. Thank you, sir.